Hey there, everybody. I'm Dr. Mica Riley here from Movement, Rehab, and Performance. Thanks for taking the time out of your day to watch this. This is a very important topic, near and dear to my heart. Being a three-peat ACLer myself and dealing with this on a daily basis with my clients, but also in my own rehab journeys as well. So we are going to hit on the topic today of fear in ACL rehab. Clearly, we know that there is just more than physical to this injury. We know that clearly we have a lot of work to do behind like strength, range of motion, and all of those things. But throughout the whole process, there is a lot of psychological components. As you probably, if any of you are about to, move on in certain phases and progress, you're going to come up against certain things that are scary, that give you anxiety, and just you're nervous about. And I think it's important to talk about these things that happen in ACL rehab, because clearly it's not just a physical injury, but it is a psychological injury as well, and one that is unfortunately not addressed enough in the ACL rehab world. But it's really important that your provider does look into this for you and helps you throughout the process, so you are confident, 100% confident before returning to sport or any activity that you choose. So, fear, or like the mental side of things, as you all have probably experienced, most of you watching might be already in your mid to late phase, or you're curious about what's going to happen in the mid to late phase. So you will not experience a whole lot of, you'll have your bouts of depression and anxieties and fears throughout the mid and late phase of rehab. But, it's not as intense as it is like at the very beginning, right? Where at the very beginning, like for instance, I cried every single day after surgery, even though I was like, yeah, I'm ready. Let's just get this over and done with, and felt very confident and secure about the situation I was going to get myself into. But then you add on pain, discomfort, lack of sleep, being on medications, your normal life not being normal at all, and having to rely on somebody to help you breaks you down really quickly. And so for me, like I cried every single day for like 2 weeks, and then it went away, right? So I was experiencing depression, and a lot of people during that time do experience depression. And, I want to also mention that the depression sometimes for people doesn't just stop after the 2 weeks once their life starts getting back to normal. It can sometimes go on and carry forward. So that's another thing to make sure that the provider and or you are looking at as well in yourself and your own journey, to see what other type of tools you need to help you have a successful outcome. So, once you get to mid and late phase, I always tell my clients that the mid phase is literally the most boring part. And the reason is because early on, you see a lot of gains. You see a lot of strength gains, and you see a lot of like just general improvements, and you're ticking those boxes of small little wins. Once you get to the mid-phase rehab, that's where a lot of the hard work begins. But it's a very almost a redundant process, because you can't just do all these different exercises every single time you go into your physical therapist, or like if your program that your physical therapist designs, it's not like this high intensity interval class that you attend and you sometimes see results and you sometimes don't, or you're just doing it because you want to work out. It's very redundant. It's very long, because strength gains take so long. And sometimes for people around this time, there can be some things that pop up, and just because of like how stagnant you feel, sometimes this is where people experience burnout, experience some fear as they enter a new territory of a phase, and sometimes frustrations, because you're like, I just want to be in my sport already. I just want to do what Jill is doing that I saw on Instagram. Why am I not doing this? And you get like You start comparing yourself to other people. You start comparing yourself to what you see on Instagram. You start comparing yourself to people inside the clinic. And, you know, I think it's important during this time to take a step back and just to remember that your journey is unique. Your surgery was different. Your injury in general was different. This could have been your third time tearing. This might be your first time tearing. You might be 16 years old. The person that you see might be 30 years old. And what everyone experiences, it's just going to be totally different. And so this is where the frustrations from all of this and the comparisons and trying to compare yourself to other people and to the protocol and all of those things can wear you down. So I always like to tell people, don't compare yourself to others. That is going to set you up for failure right off the bat. And the reason is because, like I mentioned, everybody's journey is unique and so different. And it's so hard, to say like who will or won't have a hard time in their ACL rehab. For instance, I imagined something totally different for my third ACL rehab, and it totally hasn't gone the way I wanted it to. And for sure, I experienced depression to start. I experienced frustrations because I'm an ACL rehab specialist, and I help a lot of clients every single day, every single year, and some have a very smooth process and some don't. And to see some of my clients just crushing it, which I was so excited about, internally, it was like, dang, like I want to be there too. Like, why am I not? But I have to remember, this is my third one. There was a lot more trauma than there was the first times. And I'm older, right? Like I'm much older than the 13-year-old that I'm working with, and their body's healing at a much quicker rate than mine is at this point. So that's the number one thing I would say is just right off the bat, don't compare yourself to others. The other thing is your situation is unique. What you see, there's just so much out there on Instagram that it's like, you're like, why am I not doing this exercise in my mid phase or late phase? Why am I not doing this? Why am I not doing that? And the hard part is the people that are posting those things on Instagram don't know your story and don't know your rehab situation and don't know what your knee is responding well to or not. And so it's like, the biggest thing I tell people is like, don't compare yourself to what you see on Instagram either. And the reason is because sometimes I have seen clients who Instagram ACL rehab and mid to late phase or whatever it might be, and they go and try to exercise that they saw on Instagram, and then guess what? Their knee is all flared up. And then that adds more frustration, and then you hit a setback, and that even adds further frustration. So biggest thing, don't compare yourself to others. It will set you up for failure. The other thing I like to remind people is knowing right off the bat, and then even from the get-go of your journey post-op, this is a marathon and not a sprint. There is no amount of extra work that you can do that's going to expedite the process for you. This is not something that you want to expedite anyways, because it takes a long time to do it well. And it takes a long time to make sure that you are as strong as you will ever be, even before pre-injury levels. And sometimes when people focus too much on the long-term goal, this is where it can also create frustration and anxieties and even maybe a bout of depression. So right off the bat, expectations. So your provider really needs to make sure frequently they're setting expectations and or working with you to understand what realistic expectations are and what are not. Because that's the biggest thing I see is there are providers out there that beat around the bush. They don't tell you honestly. And sometimes you need to hear that. For instance, me, I am a go-getter. And sometimes I need to be told, Mica, don't do that. Mica, slow down. To really make sure that I'm not getting myself in a situation where I'm going to experience a significant setback. So those are the two things I definitely would start off with: is don't compare yourself to others, and have realistic expectations in understanding that this is a marathon and not a sprint. And the biggest thing for it as well is, like, I tell my clients, even if you're 9 months out but not passing the return to sport testing, I'm still not going to let you go, because it's not a safe situation, because your risk is higher if you're not hitting all the criteria. And psychological readiness is one of them. Okay. So starting around month 4, month 3, sometimes, depending on the person's situation, I will use what's called an ACL RSI. It is a psychological readiness assessment that helps us determine where our athletes are at in their mindset, really, at this point in time. And I do it every single time we strength test them, so every month. And it tells us, okay, well, if I were to say, go out and do your sport, go out and participate in whatever it is you love to do, how confident would you feel in yourself, and how confident would you feel in your knee? And this helps us determine cutoffs, like where they're at, but it also helps us as providers determine, oh, my client is really nervous about playing their sport. And so it's up to me as a provider to say, okay, take this information and use it to our best ability during rehab. Okay, well, Jill, what makes you nervous about returning to your sport? What do you not feel confident in? And so making sure we have those sensitive conversations, and knowing that it is a safe space to talk about that, because we need to mentally be ready, and we need to psychologically be ready and very confident in returning to sport, because it is a component of your return to sport process. And if your provider is not asking questions or having you fill out a form like this, how are they going to know? And how are they going to best prepare you to make sure and ensure that you are doing everything possible to reduce your risk of re-injury, and to make sure that you get back to your pre-injury levels of playing your sport? Because unfortunately, a lot of people who don't go in confident will have issues and likely won't be playing at the same capacity that they were previously before the injury. So that's something important to look at. And there are cutoffs that people need to achieve in order for you to be fully cleared. The other thing that I like to highlight on is, like, for instance, it's not just these forms that you fill out, but it's the interaction on a weekly basis, right? Like, if you're nervous about something, I think it's important to say something about it. But I think there's also physical things that make you nervous. For example, that first time that your PT was like, okay, start jumping. And you're like, wait, what? Boom, your brain goes into overdrive and you're scared about it. You're like, oh my gosh, am I going to ruin the surgical technique? Is my knee going to start hurting? There's just a lot of feels and all of that. And it's really important that your provider acknowledges that, and that you are honest about what's going on. Because if you keep that deep inside and you're like, I'm really scared on the inside, but don't say anything about it, then we can't acknowledge it and we can't address it. And then we're not doing what we need to do. Okay. So during the rehab process, especially mid to late phase, vulnerability goes a very long way. And sometimes it's a new territory for a lot of you, and you're not comfortable on a daily basis talking about those vulnerabilities. But this is also going to help your outcome. So even in the moment of things where your provider's progressing you and you're nervous to run, you're nervous to jump, you're nervous to change direction, you're nervous to add 20 pounds to the barbell, things like that, where I think in the moment it's okay to say, I'm a little nervous about this. I have a little anxiety about this. I'm terrified that it's going to do X. And whatever that is, it's important, because it's like, well, it gives your provider a sense of, oh, maybe they're not ready for this big box, and maybe we need to start at a smaller box, or maybe we start without a box at all and just jump. So there's just things that need to be either progressed or regressed based on your comfort level and based on how nervous something makes you feel. I like to use what I call graded exposure. If somebody's super nervous about something, say for example, jumping, if they're really nervous to jump on a box, I'm probably not going to get the biggest box there is, but maybe what I'm going to start them off with is like starting to just jump in place without a box, and then build their confidence that way, and then work my way towards the box that we need to get to. And so that's called graded exposure, where we're letting the brain kind of say, hey, okay, this isn't scary, and getting you comfortable and confident and being like, okay, I can do this. This isn't scary. It's not so bad. But then each time you progress, you're going to experience something different. You're going to experience the normal nervousness about it, and that's okay. But acknowledging it and talking about it is the key to making sure that we have a good ability to say, okay, it basically a compromise of like, okay, you're not ready for that, but maybe we try this instead. How would you feel about that? The other thing is sometimes being scared and being nervous about certain things can also be a deterrent in your rehab process as well. You know, sometimes I often see it in people who have had more than one ACL injury, and sometimes this can be a hindrance. And oftentimes I do not see the client for their first or second ACL injury. I usually get them on their multiple, whether it's their second, their third, their fourth, or fifth, whatever it might be. And there's just a lot of general trauma from that, right? Like they want to be extra careful, which I can absolutely respect. But at the same time, there needs to be a breakthrough mentally to help us progress at a decent pace, but to make sure that there is some forward progression and moving the needle forward. Usually what I tell people, you know, I am a physical therapist. I'm not a mental health counselor or anything like that. But I do strongly suggest that people do get into mental counseling during this time, because it's important to work on yourself mentally to make sure that you're addressing everything possible, whether it's that traumatic experience you had during your second ACL injury that you didn't quite recover from, and now it's moving on with you in your third or fourth injury. And so it's really important to make sure that we break those mental blocks and barriers to make sure that we're able to progress and move the needle forward for your third or fourth. I see a lot of people rely heavily on their physical therapist for their support system, for their mental health counseling and all of that stuff. But I think it's also important, you know, I am guilty of that too, but I think it's also important to make sure that you have not just one provider managing all of that stuff, but a multitude of providers, right? And sometimes I tell people to get on with a sports psychologist during this time. If we're starting to see things become a pattern in terms of their mental capabilities and mental blocks or barriers that are restricting us from progressing forward. Because a lot of times people sometimes had a painful experience with a certain thing, and they're very nervous to challenge that, or they're very nervous and get some feels when they're starting to try to do that thing. And so it's really important you break that down and figure out where that's coming from. And sometimes it requires the help of another health provider, like a mental health counselor, a sports psychologist, or even just a therapist of some sort. But the other thing too is I think it's important, and one thing that I do with my clients is weekly check-ins. So every single time I see them, whether it's on a weekly basis, at this point, you know, in the mid to late phase rehab, I'm not seeing them very often. If everything's going well, there's not necessarily a need for that. But I'll check in with them every few weeks and ask a few questions of like, what are you nervous about? What are you fearful about? What is a small win for you? What did you win at this week? How's your stress? How's your sleep? How's your nutrition? Because all of these things matter when it comes to your ACL rehab and how your outcome is going to be. If we're not addressing every facet of your rehab, specifically the mental component, we're not setting you up for success. And so by doing these check-ins, I can see from a provider standpoint, what my client is ready for and what might be more of a challenge. So I think it's really important, and I don't think enough providers highlight that enough. You go in and they say, hey, how's it going? And it's a very open-ended conversation, but most often it doesn't give a sense of, hey, I'm inviting you to share a vulnerability with me and to talk about it and see how I can address it from a physical standpoint and how to talk about it and coach you through this process to make sure we break down that barrier and get you to the other side. So that's what happens. That's what happens in ACL rehab. And especially during the mid to late phases, you're trying to get strong, you're trying to do everything possible. You might experience a setback, which it's inevitable. Sometimes setbacks do happen. And whether you experience it early on or you're experiencing it now, or you might experience it 3 months from now, a setback will happen. And we don't know what setback will happen. Is it that you have a bout of pain? Is it that we can't just get you past a certain point or something? And that can cause frustration. And again, I want to remind you and urge you during this time to be vulnerable, talk about it, talk about your fears, your anxieties, your frustrations with your provider. Consider getting a sports psychologist or a mental health counselor or therapist on board to help you do the work on the outside of your rehab. But then also acknowledging that setbacks do happen. Talking about it is okay. Having a plan about it is definitely needed. But also making sure that you are just acknowledging it and helping yourself move forward. I think oftentimes that during a setback, a lot of people focus too much on how far they have to go from their long-term outcome or their long-term goal of playing soccer, skiing, whatever it might be. That can cause burnout. You're just focusing on the long-term goal and you're like, I am so far away. The light at the end of the tunnel is so far away, and I experienced one setback. Now I'm experiencing another one. Or I'm not running like Jill is on Instagram. I'm not running like so-and-so is, and they're the same. We had surgery on the same day. Again, everyone's unique. Everyone's story is unique. Everyone's journey is going to be unique, and how they respond is going to be different. And what their provider decides to give them as an exercise, or how they decide to progress them to get there, is also going to be different. So trusting the process and ensuring that you are focusing and taking those small little wins to really make sure that you aren't burning out and you're not experiencing unnecessary frustrations because you're focusing on the wrong thing. So it's always nice to have a weekly basis where you're like, okay, what are my small wins today? Well, I deadlifted 135 pounds yesterday, and the weeks prior I was only doing 95 to 115. Awesome, you're winning. Well, I was able to progress my box from 12 inches to 18 inches. Awesome, that's a freaking win. Things like that are going to carry you forward. Or even, I was able to do some contact practice today, and mind you, it was a little bit, but guess what? That's a step in the right direction. That's what's going to get you to your long-term goal, by focusing on those small little wins, not comparing yourself to others, and trusting the process. Okay, so I want to make sure that you have a provider that is checking in on you mentally, not just physically, not just measuring your range of motion, not just looking to see if you have pain, but mentally doing a check-in on a weekly or bi-weekly basis, whatever it might be, and making sure that they have you fill out this form, because if they're not probably giving you the care that you need and the care that you deserve to make sure that you are not only physically confident and strong than you ever were, but also on the mental side, you need to be psychologically confident and strong to make sure that you are getting to where you need to be without any issue. So If you don't feel like you're getting the care that you deserve, go ahead and schedule a consult with us. We're happy to help. We see many people across the country, many people across the globe, and we're here for you if you need it. So go ahead and feel free to comment or chat with us through the chat feature if there are any questions.